Hello, and welcome to the sixth part of the Sleep in You series, part of the Four Wing Balance Library. This series is presented by the Four Wing Health Promotion Department. This session will specifically talk about shift work and sleep, including tips for shift workers. What does shift work look like? So shift work is when work is scheduled outside of normal working hours. This definition can change depending on what resource you're looking at. Some people define a normal workday as one that occurs between 0900 hours to 1700 hours. Others say it is a workday occurring between 0700 hours to 1800 hours. During an early morning shift, someone would go into work in the early morning hours, such as 400 or 500 hours. For example, drivers may start their shifts early in the morning. An evening shift would see someone going into work 1500 hours or later, but ending before midnight. During an overnight shift, a person would begin their shift after 2300 hours and end before 1100 hours the following day. Rotating shift schedules occur when people are rotated between day, evening, and or night shifts. There are variations to rotational shift schedules that can be used to ensure that there's a full 24-hour coverage in certain trades, such as first responders. Split shifts are where people complete 2 scheduled periods of work each day. An example of this could be in the restaurant industry when staff cover meals versus staying open the entire day and night. Being on call means that you might be at home, but you could be called into work at any point. An irregular schedule is when you don't have a set shift schedule and instead your shifts change due to the demands of the job. A 24 on, 24 off shift can be seen in some trades or during specific missions. A member may go to work for 24 hours but are allowed to sleep during this time, and then they may have the next 24 hours off. Keep in mind that your shift schedule may not be one of the ones I described. Shifts are different based on your trade, your job, your unit, all of these types of things. So an evening shift to you might actually be what's called a night shift, which could potentially go past midnight. You may also have a 12-hour shift where you do sleep during it, even though it's only 12 hours versus 24 hours. So really, even though we're giving examples, this isn't all comprehensive of every single type of shift out there. So why is shift work an issue? Shift work does not coincide with our body's 24-hour circadian rhythms. By nature, humans are programmed to be active during the day and sleep during the night. When a person works during the evening, overnight, or in the early morning, it can lead to difficulties when they try to sleep. Night shift workers have been found specifically to experience increased difficulty with sleep. Our hormonal secretion is also at odds with shift work. Our body secretes hormones in a way that helps to notify us as to whether we should be awake or asleep. Melatonin, which is commonly referred to as a sleep hormone, is normally produced at night to signal us to fall asleep. Cortisol, on the other hand, is commonly produced in the morning as a signal to be awake. For night shift workers, melatonin secretion at night can cause them to be drowsy while at work, while cortisol secretion during the day will make it difficult for them to sleep. Shift work can also lead to sleep deprivation. Night shift workers sleep, on average, 1.5 to 2 hours less than a daytime worker. Accumulation of sleep debt cannot be paid back and leads to sleep deprivation. Shift work can also lead to increased experiences of stress, which can affect how our immune system functions. Decreased immune system functioning can increase the frequency in which we are sick and prolong our sickness. Studies have found that shift workers are more likely to get sick with a cold or the flu when compared to daytime workers. Another way that our biological clock affects us is by telling us that we should consume food during the day and not at night. When a person works during the evening or overnight, they need to adjust what they eat and when they eat. This can lead to experiencing gastrointestinal issues such as heartburn, indigestion, and appetite disruption. Heartburn can affect the ability to fall asleep, as symptoms often worsen when laying flat in a prone position. Night shift work has also been found to specifically increase a person's risk for cardiovascular issues, cancer, and diabetes. More research is still needed in this area, as the exact causes behind these risks are still not completely clear. The International Agency for Research on Cancer classified night shift work as probably carcinogenic to humans in 2019. This was based on limited evidence of cancer in humans, sufficient evidence of cancer in experimental animals, and strong mechanistic evidence in experimental animals. It is also believed that when our circadian rhythms are affected, the risk of cardiovascular disease may increase as our heart rate and blood pressure are regulated by a circadian rhythm. Lifestyle has also been shown to be directly linked with cardiovascular health. Shift workers may not exercise as much or eat as nutritiously as daytime workers. If you are a shift worker, it is important to speak to your healthcare provider about any pre-existing medical conditions. Shift work may influence the way you need to take medications and could potentially affect your medical conditions. There is also strong evidence that evening and night shifts, as well as rotational and irregular shifts, increase occupational injury risk. A person is more fatigued during these shifts. There is also sometimes less supervision during a non-daytime shift. Family life issues are also more often reported by shift workers as they lack the time to spend with their family. Shift workers also tend to have trouble finding time to spend with their friends or joining sports team or clubs. Social interaction is important to our physical and mental health and can be detrimental when it's restricted. Shift work disorder is considered a circadian rhythm to sleep disorder by the International Classification of Sleep Disorders. The disorder is directly related to a person's work schedule and is more prominent in those who work night shift. People who work early morning shifts, for example, starting at 4 a.m., may also experience this disorder. Your healthcare provider will diagnose you by asking you questions about your work hours, when you sleep, how much you sleep, how you feel when you wake up, and how you feel while you're at work. Although treatment is limited, it may be behavior and/or pharmacological, depending on your situation. Some research has shown that the body may never adapt to shift work, especially if the person has a normal sleep schedule on the weekend. Now we're going to look at some strategies for you if you're a shift worker. First, it's important to relax before bed. This means creating a bedtime routine that incorporates regular and relaxing habits such as brushing your teeth, reading, or light stretching, or anything else that you find relaxing. We do want to avoid stimulating activities such as using electronics or exercising. It's important to optimize your bedroom environment so that it doesn't detract from your sleep. Sleep in your bed always instead of other places such as the couch. If you have other people living in your house and your bedroom is not optimal to sleep in, find a special bedroom to sleep during the daytime. This could be on a level where you won't be disrupted by your family engaging in daytime activities on the main floor. Inform friends and family of your sleep schedule so you won't be disturbed. You may also find it useful to try blackout curtains, earplugs, and/or an eye mask or fan or air conditioner. Now let's talk about substances. Although alcohol may help you fall asleep, it will decrease your sleep quality. This means you will feel groggy and tired when you wake up. Always avoid alcohol before daytime sleeping. Sleeping pills should only be used in consultation with a healthcare provider. They may occasionally help, but are generally found to be less effective long-term. Most practitioners provide sleeping pills for less than 3 months. Melatonin is a hormone that helps us sleep. However, studies on the effects of melatonin supplements on sleep are still limited. There are a few studies that have been conducted with night shift workers in real situations. However, most of these studies have been completed in a sleep lab. Sleep lab studies have found that a melatonin supplement taken 30 minutes prior to bedtime can help a person sleep better. Half of a 3 milligram pill was found to be sufficient. There are few documented negative side effects. However, melatonin supplements cannot be recommended for shift workers due to lack of evidence-based scientific studies. Caffeine is a stimulant and can affect how fast you fall asleep, as well as your sleep quality. As you age, these effects increase, especially once you are over 40 years old. Avoid caffeine in the last 4 to 5 hours of your shift if you are sleeping after. As a shift worker, it's also important to figure out when you should sleep. There are a variety of options available to choose from when deciding what is the best time for you to sleep between your shifts. Most night shift workers choose to sleep when they come home from work. As an example, if you work the night shift from 2300 to 700 hours, you may choose to sleep from 900 to 1600 hours. Night owls and young adults tend to prefer this option. Recommendations when choosing this option when using the sleep schedule include going to bed as soon as you get home. You'll see in the example there's some buffer time for commute. This could change depending on the length of your commute. Plan to sleep for at least 7 hours. Avoid light in the morning. You can use sunglasses or orange glasses that block light if needed. Make sure your bedroom is completely dark. This can be done via blackout curtains or an eye mask. Expose yourself to light, whether sunlight or a light therapy lamp, when you wake up for 1 to 2 hours. Advantages of this sleep schedule include having an easier time falling asleep and the ability to sleep longer. Individuals will also have the opportunity to eat supper with family and engage in evening social activities prior to going into work. Disadvantages include being drowsier during the night shift because you've already been awake for several hours. You also won't have any downtime or transition time between work and sleeping. You won't be available for any family activities in the morning. In addition, depending on where you live, you may experience limited exposure to natural light during the winter season. Another option is sleeping before you go to work. This is a method most preferred by early birds and older workers. An example of this sleep schedule is sleeping between 1,300 to 2,100 hours if you work 2,300 to 700 hours. Recommendations when using this sleep schedule include planning on sleeping for at least 7 hours, take a nap in the evening prior to beginning your first shift of your shift cycle, expose yourself to light via natural sunlight or light therapy lamp for 1 to 2 hours in the morning, and sleep in a dark bedroom. Again, blackout curtains and/or an eye mask can come in handy here. Advantages to this sleep schedule include feeling more refreshed and awake up during your shift, having a smoother transition to a daytime schedule, having time after work to relax before going to bed, and being available for family and social activities in the morning and at lunch. Disadvantages include being tired after your first shift as you'd be awake for a long time, potentially having difficulty falling asleep during the evening, and not being available for family or social activities in the evening or for supper. Some people may choose to split their sleep into 2 parts. For example, if you work from 2,300 to 700 hours, you may choose to sleep from 800 to 1,200 hours, and then again from 1,600 to 1,900 hours. It's important to plan to sleep for at least 7 hours total in a 24-hour period, with at least 3 to 4 hours of continuous sleep per segment. Avoid light in the morning by using sunglasses or light-blocking glasses. Expose yourself to light via sunlight or light therapy lamp in the afternoon for 1 to 2 hours. Make sure your bedroom is dark. Advantages of this sleep schedule include increased total sleep duration during the day, feeling more rested and alert at work, having an easier transition between fast day to night rotating schedules, and being available for family meals. Disadvantages include having difficulty sleeping in the evening, feeling as though you're spending your entire day in bed, and not being available for family or social activities in the evening. Regardless of your sleep schedule, it's important to anchor sleep. Anchoring sleep is one of the recommendations for shift workers as it helps to increase both the quantity and consistency of sleep. When you anchor your sleep, you are sleeping 1 to 2 hours 3 to 4 hours during the same time period every day, regardless of whether it's a work day or not. To anchor your sleep, enter your work schedule in a sleep diary. Designate 7 or more hours of sleep per 24-hour period. Designate 3 to 4 hours of anchor sleep that will remain constant on both work days and non-work days. Then stick to that schedule. Anchoring sleep is generally easier said than done and may not be suitable for everyone. However, when done consistently, it can be very beneficial. Daytime napping can be helpful for those who work shifts as it can help you achieve at least 7 hours of sleep during a 24-hour period. Plan daytime naps in your schedule to ensure you achieve 7 hours of total sleep time. Naps should occur at the same time every day. Some workers have the ability to nap during their shift or during their breaks. A nap has been found to have the ability to increase alertness among shift workers. Ensure that you give yourself a few minutes to adequately wake up after a nap so you don't increase your risk when returning to duties. Light exposure during the night helps to stimulate the brain and resets the biological clock, which can help to improve alertness during work. High-intensity light, such as a light therapy lamp, will produce stronger effects. Light exposure may not be suitable for or possible to everyone. Let's talk about when to expose yourself to light. Exposure depends on your sleep strategy. So timing of light will differ depending on if you're sleeping before your shift, after your shift, or splitting your shift. If you sleep after your night shift, you want to expose yourself to light at the beginning of your shift. If you sleep before your night shift, you want to expose yourself to light at the end of your shift. And if you split your shift by dividing it into two segments, you want to expose yourself to light in the middle of your shift. Let's talk about eating well. Eating well and having proper nutrition is important to overall health. If you work night shift, it has been found to generally be better to eat at the beginning and the end of your shift. If you're hungry, avoid eating heavy meals and instead consume light snacks between the hours of 12 a.m. to 6 a.m. To avoid being tempted by unhealthy selections from the canteen or vending machine, pack your own food. It's important to avoid high sugar and high fat foods, which are harder to digest during the night. Plan to eat your main meal in the evening prior to going to work. Avoid foods that are fatty, spicy, or sweet, as these foods can increase drowsiness or lead to indigestion. If you sleep after your night shift in the morning, eat a light and nutritious breakfast before sleep. Examples include whole grain toast with peanut butter or a whole grain cereal with 1% milk and berries. Try to eat at the same time every day, regardless of what shift you're working or if you're on your days off. The Canadian Physical Activity Guidelines for adults aged 18 to 64 stipulates that, in order to achieve health benefits, you need to accumulate at least 150 minutes of moderate to vigorous intensity aerobic physical activity per week, and engage in muscle and bone strengthening activities at least twice per week. Physical activity is beneficial to our sleep overall, as it improves our sleep quality and increases our energy level and helps to relieve stress and anxiety. Regular physical activity can help to counteract the negative effects of night shift work. When possible, take your sleep strategy into consideration when planning your physical activity. If you sleep after your night shift, be active in the evening. If you sleep before your night shift, be active in the morning. It's recommended to try to be active outdoors when possible so you can be exposed to natural light. Stress has been shown to cause a lack of sleep by making it difficult to fall asleep and increasing nighttime awakenings. It can also affect our perceived quality of sleep. Chronic stress can also cause a variety of health issues. It's important to understand what your stress triggers are and find solutions to these triggers. Lack of time is generally a major source of stress for shift workers. If this is the case for you, try to reevaluate your priorities to identify necessary activities. Get help with responsibilities so you can have time to exercise or spend time on a hobby. It's important to increase your feelings of control over your life. Night shift workers are at increased risk of a motor vehicle accident after their shift. This is generally as a result of being awake for a long time, being tired from working, and experiencing an impaired functioning of their biological clock. Drowsiness has similar impacts to driving, while impaired by alcohol, as both judgment and reflexes are impaired. Impairment after being awake for 17 hours is similar to having a blood alcohol content of 0.05. Impairment after being awake for 21 hours is similar to having a blood alcohol content of 0.08. This also affects professional drivers as well. They are not immune. To try to reduce risk, there are some strategies that you can try. When possible, try walking or using public transportation if available and safe to do so. Vary your route so you can reduce the potential of being on autopilot. Carpool with others who are on your shift. You may also consider moving closer to work to reduce your commute if possible. Remember that the warning signs of drowsy driving include trouble keeping your eyes open, yawning, wandering thoughts, your car drifting over the lines, and missing exits or turns. Stop driving if you have any of these warning signs. This is the end of this section of the Sleeping You series. To learn more about sleep, check out the rest of our 7-part series.